Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Perham Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, and welcome to Wellness for Life. We are back here at Mojave, and I am joined with Carrie. Carrie.
Hi, thank you.
Yes, we are here to talk about Head Start and all the different programs that you have here.
Yeah, we've got a lot of exciting stuff going on. We're continuing to enroll for the summer programming, which is always fun, going through the summer and then getting ready, geared up for the school year, which is getting closer than we hope.
Yes, yes. You know, summer goes by so fast, unfortunately, but it is time to start thinking about those fall programs and if people want to get their children enrolled. You guys have a lot of great programs here for different age groups.
You know, we offer such comprehensive services for all of the children from birth to 5 and pregnant moms. So during the summer, what we have going on is our family child care, and we do enroll all year for that, because we never know when we're going to need childcare. We start new jobs and those things. Yeah. So childcare is always something that we're enrolling in, but we are gearing up for the school year. And we have center-based programming for our preschoolers. We have a combo program for those young preschoolers, which is a little bit of home-based services and a little bit of preschool, so they get both of those experiences. Our home-based program is 0 to 3-year-olds and pregnant moms. Okay. So that's very exciting. So a teacher comes into the house once a week, and then also there's a socialization time which happens at a site where they can engage with each other and parents can talk and kids can play together. So.
Sure, great. And two, we cover a lot of communities with TV3, and you guys are in a lot of communities. So I want to just talk about the different communities that you guys have offices and services in.
Yeah, we've got some really exciting stuff going on. We will be opening up family child care and center-based child care in Otter Tail and Wadena counties. Okay. So that's really exciting because that is some new programming for us this year. Sure. But we also are in Mahnomen County with center-based full-day preschool, and we have home-based option in Mahnomen. In Becker County, we have the home-based combo center-based programming and lots of family child cares that we work with in the communities of Frazee, Detroit Lakes, Lake Park, Audubon. So that's exciting. Wow. And then also over in Park Rapids, LaPorte, and Nevis, we have services.
Okay, great. Yeah, so you guys cover a nice area for people. Carrie, what are the benefits of Head Start?
Head Start is a very comprehensive program, and not only do we provide preschool services for the kids, but also we pay attention to dental, health, mental health, any disability needs that they might have, and we support the family in getting any resources that they need to provide access to those services for their children.
And Carrie, how about the child development aspect of Head Start?
Well, child development is so important. It's a great science that we're learning about, and we know that child's brain develops so much prenatally through the age of 5. So we really try to work with the parents to understand child development and work with the children in the classroom to provide developmentally appropriate experiences so they can learn and grow.
Sure, wonderful. And of course, to enroll, what is the process if people want more information?
There are applications throughout the community, but you can stop by here. You can give us a call at 218-847-1385, and we can mail you out an application so you don't even have to come in to do that initial paperwork. But then when you do come in, we'll have a little conversation and we will get your application processed. Head Start is a program for low income and high needs children, so we are a points-based system. It's not a first come, first serve, which is sometimes important to know because parents often ask, well, when am I going to know? When am I going to know? Well, it's when your application is the next in line.
Okay, wonderful, wonderful. Thank you so much.
Thank you.
And thank you for joining us on this feature of Wellness for Life.
Coming up on Wellness for Life.
Hello, my name is Matthew Koffenberg. I'm the owner and physical therapist at Perham Physical Therapy. Today we're going to conclude our 3-part series on night pain by talking about carpal tunnel syndrome. Prior to diving into carpal tunnel, I did want to remind you that if you do suffer from night pain, whether it be your shoulder, your hip, or your wrist or hand, please talk with your doctor first. There's so many different causes to night pain that it's really important that you get a thorough evaluation to determine why you have this night pain. So today we're going to talk about carpal tunnel syndrome. So what exactly is carpal tunnel syndrome? Simply put, carpal tunnel syndrome is a compression of a nerve, specifically the median nerve at the wrist. So if we glance over here at the hand, here's a picture of our hand, and here's the wrist. This yellow substance, as it comes underneath through here, that is our median nerve. And that median nerve can get compressed. If it gets compressed, it's going to lead to symptoms of carpal tunnel syndrome. The symptoms of carpal tunnel syndrome could be numbness or pins and needles in your hand and fingers, or it could be pain. Now that pain could be nighttime pain. You might wake up because of that particular pain, or it could be daytime pain. You know, if you have a job where you're using your hands a lot, whether you might be extending your wrist, you might be flexing your wrist, you might be using your fingers a lot, you could end up with some pins and needles, some tingling, and some pain in your hand. Now typically it's going to be these three fingers that are affected. Usually it's the thumb, the pointer finger, and the middle finger that are most affected with carpal tunnel. The final symptom of carpal tunnel syndrome is actually thumb weakness. So if we kind of go back to our picture here and look at this median nerve, so again, this yellow substance is our median nerve, and it's got several branches to that median nerve. One of those branches actually comes in and supplies the muscle that controls our thumb. So if you have significant compression, long-lasting compression on that median nerve, you could actually end up with some thumb weakness. So to really truly understand the cause of this compression, you need to have a really good picture of the anatomy of the wrist. So we're going to do a cross-section of the wrist. So if we look at our next picture here, this is a cross-section of the wrist, and our first session here of night pain was about the shoulder, and I talked about a floor and a ceiling. We can utilize that same analogy here for the wrist. We can talk about the floor of the wrist. The floor of the wrist is made up of bones. Those bones are called carpal bones. And then on top of the floor, we actually have a carpeting. And the carpeting is our flexor muscles, flexor tendons, and the flexor sheath. And then the ceiling is actually a ligament. So this white structure here is our ligament, and that's the ceiling. The blue and the purple, that's the carpeting. And then the occupant of the wrist is our median nerve, and that's our yellow structure here. And you'll notice that there's very little space there. There's very little room for that median nerve to move. So that median nerve can get compressed quite easily. So when that happens, you can end up with carpal tunnel-like symptoms. The main reason for compression of that median nerve is actually activity of the hands, flexion and extension of the hands. So if we flex the wrist, what'll happen is the carpet, so here's the purple, that carpet and then the ceiling, that ligament will come closer together and it'll compress that median nerve. Remember, that yellow structure here is our median nerve. So when we flex, we'll compress that median nerve. So at night when we sleep, we often will sleep with our wrist in a flexed position. For prolonged periods of time, that'll compress that median nerve, and you can end up with some symptoms. Now, if you have a job where you're constantly extending your wrist, that'll actually stretch the median nerve. So every time we extend our wrist, that nerve is going to get stretched and potentially can get irritated. So other causes are just simply fluid buildup in the wrist. You could have arthritis, which increases the pressure on the wrist. You could have a fracture, which increases the fluid in the wrist, which compresses that nerve. And then finally, just the size, genetically the size of your wrist, that can reduce that space and cause a compression on the median nerve. How do we manage carpal tunnel symptoms? The key is early diagnosis. The sooner you can get on top of carpal tunnel, the better off you're going to be. Rest is incredibly important to reduce the fluid, to reduce the irritation on that median nerve. If you're experiencing night pain, you really want to use some sort of wrist splint. It's called a neutral wrist splint. So you want to make sure you keep that wrist in a nice neutral position at nighttime. So we'll often use a splint to keep it here. We don't want our wrist to fall into this flexed position. So we have people utilize a splint to keep that wrist in a nice neutral position. Anti-inflammatories are important, and of course physical therapy can really benefit to reduce fluid, to reduce inflammation, to mobilize the tendons in the flexor muscles. In really severe cases, sometimes surgery is needed to increase the space and take that pressure off the median nerve. If you're suffering from any sort of night pain, please don't hesitate to contact me at 218-346-2464. I'd love to talk with you and see if we can come up with a solution.
Thank you for watching Wellness for Life, brought to you by Perham Physical Therapy, Sanford Health Clinic and Same-Day Surgery Center, Perham Area Community Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,